Good morning, Quad Cities. I tell you, I had a great morning. My brother came into town last night, stayed overnight, and it was just absolutely wonderful. And then this morning, we went out to breakfast with one of my favorite people, Dr. Bowman, or Reverend Bowman. He's the pastor of Calvary Church down there in Moline, and it was a wonderful time. It's something that I think that well, let me just give you a characterization of it. I mean, here's a very sincere guy. I mean, if there's anything that I could say about him, he is really concerned and he loves his people. It's something that is extremely important, of course, for a pastor anyway. And so what we talked about were some very meaningful things. And the main thing, by the way, was that it's important to have a heart that helps people. And that's the main thing that was the subject of the conversation. And what I wanted to say this morning was just to kind of leverage that. Now I have the earphones here, so I wanted to leverage this, and that is that people anybody who's living their life, a lot of the health that we experience throughout our life has directly to do with how much we are helping other people. And the meaningful part of my concern in my practice is basically, am I actually making a difference in people's lives? And what I wanted to tell you is this, that the burden of actually the stress and everything involved with wanting to make a difference in other people's lives and help reduce their suffering, help them become the kind of individual that it's important to be in order to make your own life meaningful. It's so important. I mean, let's face it. Suffering is something that we all experience, and it's something that when we can actually make a difference in somebody else's life, our own suffering seems to decrease. And that is basically the message that I wanted to give you this morning. Our conversation this morning, talking to this man, this great man, Pastor Bowman, one of the things that, I mean, he actually has a difficult time not suffering right along with his counselees. He has such a big heart that he embraces them and encompasses them. And it's the kind of thing where he is what would you say? Well, he's trying to be the example of a person that finds his joy and finds his meaning in reducing other people's sufferings. And that's what I would encourage most of you out there to do. I don't care what your religious persuasion is. We all have slightly different beliefs as far as those kinds of issues is concerned. But the one thing that seems to be a thread throughout all of it is that if we're helping others, we're helping ourselves at the same time. I mean, reducing suffering in somebody else's life on a very cursory and shallow level is that at least if they aren't suffering as much, then they're not going to cause us to suffer as much. But on the other hand, it makes the entire world better. So that's the first message. I want to also just pause just a second to invite you to our seminar on Tuesday evening. The reason we give that is because it's important for people to actually know why they are having the problems that they're having. And one of the biggest problems, of course, these days is problems with weight gain and the inability to lose the weight. And that's what we are specializing in our weight loss seminar. We're actually helping people understand where they are in their food journey, in their dietary journey, etc. We're trying to help people understand what they can do to make their life better. Also, we've been seeing more and more people who are addicted to opiate drugs, etc., prescription opiate drugs. And these people they have a legitimate concern. I mean, they are living a life that is in pain. And we acknowledge that it's important to do what you can to diminish the pain. On the other hand, the first thing to do to diminish pain is to improve the function of the part that is causing the pain. Recently, we've had an individual come in who listened to one of our radio programs, as a matter of fact, or heard about us through one of our radio programs. And this person had horrible knee pain that was just doing a lot to slow them down, make them unable to do the things that they considered most meaningful. And even when they would force themselves to do what they wanted to do, it was a horrible thing, because they would have to experience so much pain on the way to get to do what they wanted to do. And they came in and they had heard one of the programs. I think it was the one on the A word, the arthritis word. And that was something that they responded to, and they came in, and within just a fairly short period of time, they are experiencing a lot of relief without extra pain medication. As a matter of fact, I believe they went off their pain medication altogether. And this is kind of an example of what can happen. I mean, if you're taking an opioid drug, and if you're not sure of whether your drug is an opioid drug, go online, Google it, and find out whether yours is an opiate drug. Because a lot of these, drugs, they never say as part of the title, this is opium. This is like heroin. It never says that. It has some other, esoteric name that you would never guess that it was an opioid drug. So go online and find out if you have an opioid drug, and then take steps to actually solve the problem that you're taking the opioid drug for. And that is the first step. And I cannot emphasize this enough. You've got to get yourself into a position where you don't need the opioid drug anymore, okay? A lot of people take it for low back pain, for leg pain, for sciatic pain, for knee pain, for foot and ankle pain, for headaches, all these different things. Yes, they do respond to opioid drugs in terms of the pain, but they only do so for a week. So don't think that there's an ultimate solution in the opioid drug even. It just does not work that way. And I've explained on other programs why it doesn't work that way. But if you can improve the function of the neck joint and the muscles, etc., or if you can improve the function of the low back and get rid of the sciatic pain, if these happen, then you don't have that as a reason to take the medication anymore. And you can then start working on that, because the addiction problem to opium is a secondary problem. Take care of the primary problem first. We welcome you into the clinic, and we will help you with that primary problem to get rid of the pain problem, and then you can start working with your medical doctor to get rid of the secondary opium problem. But we welcome you to come into the clinic. Give us a call at 309-764-2115. That number will also be given at the end of the program in case you missed it just there. Okay, so the reduction of suffering, though, is the key to all of this, because we want everybody to live a perfectly meaningful life. And living a meaningful life is helping others accomplish their goal. If that becomes one of your goals, is to make or to reduce suffering generally throughout the human race, that particular goal is something that will actually help you have so much meaning in your life that when you suffer, you can transcend that suffering. And that is something that is so important to do. Okay, so we got the weight loss seminar. Please, pay attention and make sure you get off of your opiate drugs. First of all, deal with the primary problem. And then the third thing is that when it comes to chiropractic, the main thing you need to remember is that the chiropractic adjustment works with the function of the spine, but affects primarily the nervous system. Sure, when you have a swollen joint, that's bad enough. I mean, because a swollen joint is something that can be painful on its own, and it can actually refer pain into the head, into the back, etc., on its own. In fact, one of the most painful things is what I call the ice pick syndrome, where you feel like you've got an ice pick sticking out of your back. And what that generally is, it's a rib subluxation, where the rib is just a little off the joint becomes inflamed, the capsule around the joint, the sac around the joint starts to swell, and I'm telling you, it is painful. And then to set it off, there's a little nerve that runs right from there and runs right down the whole course of your rib around to your sternum in front, the breastbone in front. And when that nerve becomes involved, then it feels like you've got somebody driving a dull stake all the way through your chest. As a matter of fact, I've had many patients who have gone to the emergency room thinking they're having a heart attack with that problem. And it was only, thank goodness, it was only this rib subluxation where the rib was just a little out of joint, became inflamed, and started referring the pain. So that's the main thing, though. The joint is incredibly important. The swelling of the sac and the posterior part of the spine, that joint is incredibly important for pain syndromes with chiropractic. But then the nerve is really the center, because the nerve is what is often affected by this inflammation right by the joint. The disc is sometimes also involved, and swelling in the disc can occur also and cause huge problems. But when it's not a swollen disc that's frankly causing the problem, it's usually that posterior joint. But when it affects the nerve, then of course the problem can be, it balloons into a cycle of problems where the nerve affects the muscle, which is getting too much stimulation. For example, if you've got a nerve, a normal nerve sends out an impulse, and we'll just tap it out here like this, and that's a nerve that is responding normally, and it tightens the muscle just enough to have proper posture. But then when the nerve is irritated by the spine, and that muscle spasms up and creates all kinds of problems. And we're going to talk a little bit more about those problems when we come back from this word from our sponsor. Okay, we were talking about joints and nerves and how it all works and how actually, get right down to it. This is kind of the center of our business. I could tell you story after story after story. In fact, since this is the center of the chiropractic that we do in our clinic, I could tell you any story about our successes at the clinic, and it comes down to pretty much the same thing. What we're doing is we're getting joints healthier, and when we get the joints healthier, that takes the irritation off of the nerve that goes right past that joint. And when we take the irritation off the nerve calms down, the muscles calm down, and the muscle pain, etc., starts to go away, and the referral pain from the muscle goes away. So let's take that back again. We've got the nerve creating problems with, the joint creating problems with the nerve tightens that muscle. Remember, it was going, and that muscle just spasms up. Now, when the muscle spasms up, other problems happen, because when the muscle cannot relax, it cannot get rid of its waste products, and it starts to become inflamed also. And when a muscle becomes inflamed, then the muscle begins to refer pain from that muscle into other parts that are related to the nerve in the spinal cord. Okay, now I'm not going to go into much detail there, but all you need to do is this. If you've currently got a headache right now, and that headache is behind your eye, what I want you to do is reach up to your neck, and that big muscle that goes down from behind your ear down to your front of your collarbone, I want you to take that muscle and I want you to pinch it on the side that the headache is on. And if that headache starts to flare up, now hold it there, pinch it hard, and if it starts to flare up, if the muscle's sore and it starts to flare up, then that muscle is being told to spasm by a nerve that is connected to your spine, that is probably irritated at that spinal level, and that muscle is actually referring pain into behind your eye and things like that. If the headache is over your ears and in the back of your head, reach up right at the base of your skull and push hard into those muscles. And if you find a sore place, just keep pushing hard, or have somebody else do it if you can't get the leverage. Push hard in there and see if that headache increases. If you've recently had a headache, you might be able to reproduce that headache by doing that. And the lesson there is very simple. That muscle group is being told to spasm by the nerve. And there's no way you can get it to stop being told to spasm without working on the spine, because the joint is irritated, it irritates the nerve, that spasms the muscle, and that sends the headache. And I have to tell you that my 28 years of experience in chiropractic has taught me that almost all headaches, with a few exceptions, start with the muscles that are spasmed in just that way. And you can trace them right back down to the level of the spine where the nerve is being irritated and the joint is swollen. So, if you want to solve these headache problems, if you want to get at the root where the headaches start. Now, once the headache starts, you can balloon into something even worse. But where they usually are triggered is right there in the spine. And so a chiropractic adjustment and some trigger point work in the muscles will generally get rid of the headache right on the spot without medications. But if you want long-term results, of course, you have to actually rehabilitate the joint, get it working properly. And joints, typically, when they have never been worked on, when they've been sick for a long time, there's kind of a 90-day window where you're working on them, and so that you can get them back into shape. And we'll talk a little bit about that 90-day window when we return from this word. When I was first in practice, I had a helper there. My front desk person was pregnant. She had her baby, and I had to have a person in to help me out with the front desk and the phone, etc. And she was with us for about 3 weeks. And during that time, she was excellent, by the way. And during that time, all my staff gets free chiropractic care. And she had never been to a chiropractor. But I could tell that she was suffering from some things. And so I asked her about it. And she said, well, I've got a headache right now. And I said, well, would you like us to help you with it? And so in the ensuing history and things that I took on her to make sure that I had covered all my bases, etc., I found out that she had been having about 3 migraine headaches a week, and that it had been going on for in excess of 5 years. And these were not just simple headaches. These were very complex and devastating headaches. As a matter of fact, I think that the reason that she was available to work for me was because she, hadn't she had problems with jobs before because of the headaches. And so we began working on her, and it took a little while, but within a relatively short period of time, she was headache free. And, she went down to maybe 1 headache a week, and then she went down to no headaches for quite a long time. And by the time she finished working for me, she was pretty much headache free. Hadn't had a headache for a week or so, and then she remained a patient after she stopped working for me. In fact, that was probably in my 2nd or 3rd year of practice, so she's been a patient for well over 20 years, and she's never had the headache problem again. Why? Well, for one reason is she kept up with her spinal health. We maintained her joints working properly. Has she had headaches in between? Well, yes, she's had headaches in between. But in terms of becoming a headache person, she has not been a headache person since those 3 weeks that she was working for me. So it's very important. I mean, this is something, if you're going to have a meaningful life where you're going to be able to transcend your suffering, you can't be the victim of outrageous suffering. You've got to be a person who has gotten it together, and so that you can help others with their problems and find the ultimate fulfillment and transcendence of suffering in your life, and put it together that way. I would invite you, if you're having problems that is preventing you from doing what you want to do in your life, preventing you from being the person you want to be, one of the things that we can help you with is we can help reduce your pain. We can help you feel better. We can help you with your energy. We can help you with your weight problem. In fact, one of the things we've gotten into in a great deal these days is the use of infrared light in order to energize tissues. And infrared light is proving to be amazing. Our first foray into it was with diabetic foot ulcers. And we had a patient who had a diabetic foot ulcer that had been, just wouldn't heal. A lot of neuropathy in the feet, wouldn't heal for over 1.5 years. And within a month and a half, it was completely closed. It was about the size of a pencil eraser and about the same depth as a new pencil eraser. So it was almost all the way to the bone in the heel. And within a month and a half, it was completely gone. After 1.5 years, all kinds of surgeries, antibiotics, skin grafts, everything else wouldn't do it. But the use of penetrating, healing infrared light did help it. So, I'm not going to go into all the details as to what frequencies of light and wavelengths and all that stuff we used, but it was very, very powerful in terms of what helped that particular condition. And since then, we've been using infrared light for just a massive number of things. So whether it's nutritional problems, weight loss problems, chiropractic problems, with back pain and headaches, etc. All the things basically that push a person to go toward opioid drugs in order to deal with the pain. All of those things, take care of those problems first, and then you can start dealing with the secondary problems of getting off of medication. And that has been something that, whether weight loss or whatever, last week we did a program on diabetes and how that you don't have to have type 2 diabetes. In most cases, dietary changes and lifestyle changes, exercise changes and things like that can get you past the disease and can free you from your medications. High blood pressure, another one. Many people come in and they're on several blood pressure medications, and by the time they're finished with the ideal protein diet, they're off of their medications. And so the medications cause secondary problems. And so it's important to make sure that you know that the thing you need to work on is your primary problem first. And out of the programs, we've gone into detail as to why obesity causes high blood pressure. And just in a very short version, you've got to have high blood pressure if you're obese because you've got so many more miles of blood vessels to force that blood through. And so your body needs high blood pressure. If you've got 700 extra miles of blood vessels, which an extra 100 pounds on a person will require, you've got to have high blood pressure to get the blood through all of those extra tubes. So you can't grow another heart. You've only got one heart, so you've got to push it through with more blood pressure. So that's something to consider. If you want to get the blood pressure down naturally and do it so that you solve the primary problem first, and then you can start working on the secondary problem of getting rid of the medications. That's what you need to do. So come to the Welcome to Health Center. We have a great staff there. In fact, my staff is so good at this point. It's going to work in the morning is like, being in heaven, because I know I'm going to get the support I need to help people get healthy. And they are all on board. They know exactly what they're doing. They're well trained. And I have to tell you that it's possible to get a person on board or hire a person, train them well, and them still not be well trained. My staff is so good. I train them as well as I could, and then they just train themselves. It's absolutely wonderful. And they'll help you see how you can train yourself to be the healthiest person you can possibly be. And that's what we're all about there. We want to make the Quad Cities the healthiest cities in the country. And we got a great shot at it because we've got a great art community, we've got great music community. We can be the healthiest cities in the country if we choose to be. And the Welcome to Health Center can be at the center of that for you. Talk to you next week. Bye-bye.